Good morning, and thanks for joining us on The Real Story. I'm Jen Bernstein. A year after this pandemic changed the way we live here in Connecticut, all adults are now eligible to schedule a vaccine appointment. It's really incredible if you think about how far we've come, from learning about the virus, trying to treat it and save lives, to the ability to quickly develop vaccines to get this pandemic under control. There's no playbook for this. Our elected officials, as well as our healthcare leaders, at the forefront of making life and death decisions in an ever-changing environment. So to reflect and to give us an update on how vaccination efforts are going so far, especially with this latest group now eligible, is Hartford Healthcare CEO and President Jeffrey Flaks. Thanks for being here this morning.
My pleasure. Good morning, Jen.
All right. So what an undertaking this entire year has been. I'm going to reflect with you in a moment. But first, give us an idea. This latest group, I think it's 1.3 million people added to the pot of people who are eligible. How's it going so far?
It's a great moment of progress for the state, and it's an important moment that now vaccines are available and open to be scheduled for all people 16 years and older. It's going well. Of course, there's challenges in the earliest days because there's, demand in many ways can outstrip capacity. But we continue to get better at this and continue to get more vaccine into the state. Jen, the issue really throughout this crisis has been the amount of vaccine we get from the federal government. We're able to administer as much vaccine comes into the state within 6 days. And this week alone, we're going to do about 30,000 vaccines just within Hartford Healthcare. So we're making real progress. So
if people are still trying to sign up or they're having trouble getting into the websites, give us an idea. Do you get the shipments in weekly? Is there a day that those appointments come, online that people can watch for?
So the shipments do come in weekly. We work closely with the Department of Public Health, with the federal government. But throughout the week, sometimes the shipments actually increase. So this week alone, we got about 4,000 more vaccines than we anticipated for the week. So we adjust every day, and it's about agility. And we have more capacity to call people in earlier. Our mission, our sole objective, is to get the vaccine as safely, as quickly, and as efficiently as we can in people's arms as possible. And when they come in, we're going to get them out the next day if at all possible.
Yeah, I mean, it's impressive. When the eligibility opened up, that morning, people who went on your website, including me, there were tons of appointments that were available, and I had all of them open, Walgreens, CVS, Walmart, other healthcare systems, and yours was pretty streamlined. Tell me what went into the process of making sure the website could handle this, because obviously you have my chart for people who are within the healthcare system and can use that, but the capacity to have all of these people trying to get appointments. How did you do that?
Well, we've never been in a situation like this before, where literally hundreds of thousands of people could try to go to the website simultaneously, trying to work through the website's, scheduling algorithm. So we continue to expand our bandwidth. We continue to refine the technology repeatedly with the feedback we get. And we do everything possible to make it as user-friendly as it possibly can be. And I'm really pleased that, we've been able to maintain the optionality within our site where people can choose Moderna, Pfizer, or first available, and they have the capacity to select from across the entire state of centers that make most sense for them, or what we always advise to try to do is take first available.
You went from this time last year, we were trying to get everything in gear and understand this virus. And now, more than a year later, we are sitting here and giving vaccines to the general population here in our state, or for the most part, adults 16 and over. What have you learned in the last year? I mean, this has got to have been, well, it was, and it is a huge undertaking, and you're in this leadership spot, and there's no playbook for this, right?
There really isn't. Jen, we've learned a tremendous amount. I've said throughout this crisis, in so many parts of our lives, we all yearn for things to get back to normal, and we do. But in healthcare, we cannot accept going back to normal. We have to be better than normal, and we already are better than normal. I look at things, Jen, like our virtual health. We went last year in February, a year ago, we did about 400 virtual health visits. From March to March, we did 400,000. So we've totally changed the way people can access our providers, the way that we can bring services to people off hours and weekends. Tremendous progresses. The work we've done around infection control procedures within our hospitals. We have no flu, not a single case of flu within our hospital. The work that we've been able to do with personal protective equipment. Today we bought $50 million. We have more than a 365-day supply of personal protective equipment at the use rates we're experiencing right now during this pandemic. So there's been so many advances within this process that already make us better than normal. And most importantly, the work we're doing around the inequities in healthcare and the need for us to do a considerably better job of bringing care to our communities who are most vulnerable and working hard to address the inequities that do exist and where the alliances and partnerships that are being built to deliver trusted services in this community. We're never going to go back. We're going to be doing breast health and prostate health and digestive disease and bariatric screenings and through these very channels we built during the pandemic. So I'm encouraged about the future, and I'm very encouraged that from this pandemic we will emerge from a healthcare standpoint better than we've ever been.
I didn't even think of that, but that's so true. There are so many aspects of your business that are going to change and have changed, and it's almost, in a lot of ways, for the better because the amount of care that you're able to, the access to care increasing, whether it's through the telehealth or, the online ability for people to come on and do it that way, the mobile vans that you have going out. I mean, now you can do them for other healthcare means. Let's talk about those mobile vans. We have this FEMA unit that you and I were just discussing before. It is the first in the nation. Connecticut got chosen, you told me, to use it. Tell me what it is and why Connecticut was able to get a first stab at it.
Now, first of all, we have to recognize our governor. We have to recognize our congressional delegation. The fact that Connecticut was selected first amongst the 50 states to use and pilot the FEMA van is an enormous recognition of our leadership in the coronavirus response and the results that have been created here in Connecticut. And it's a tremendous honor for Hartford Healthcare to be selected to be the pioneer. And we're doing 10 days in Bridgeport as we speak. We are relocating the van to 5 different sub-communities within Bridgeport, and we're delivering about 4,000 vaccines over these first 10 days through the FEMA van. This van and then the very vans that we've been operating for over a year are critical because they can allow us to go to homeless shelters, to go to churches, to go to community centers, to do pop-up centers in different parking lots and bring our care into the community. And Jen, we don't do this alone. We do it in partnership with trusted local leaders. We do it with respected local organizations, and we marry them with our resources. And we're never going to go back. When we go, these vans are never coming off the road. We've built now mobile clinical teams that are very adept at safely setting up these procedures in the community, and we're going to continue to leverage that as we work to fight the inequities that exist in healthcare, both across the country, but most importantly here in Connecticut.
Yeah, no, that's huge. All right, so where do we go from here? Because even though people are getting their shots right now, their first, their second shot, we're hearing about Pfizer saying that a booster shot is likely going to be necessary. So, I mean, even though that we might be able to get the pandemic more under control, the need to put energy and effort into vaccination efforts is not going to stop. What are you hearing on your end?
That's true. So first, Jen, I have to tell you, Dr. Patrick Troy, who in Hartford is one of our senior physician leaders in our critical care center, who are amongst the greatest heroes, people working in critical care today in healthcare. I heard him speaking recently, and he said that creating this vaccine, in 9 months was analogous to putting a man on the moon in terms of the accomplishment to create a vaccine for a virus that had never existed before with the success of these vaccines. So it's really incredible, and it's another area that will stimulate more research and will ultimately be adapted to more in other diseases as necessary and where appropriate. So the vaccine, we have to continue. This is a race. And the race is to get it to the community, into each person who chooses to get the vaccine as quickly as we possibly can and as safely as we can. About 43% of residents in Connecticut have now had at least their first vaccine. So that's great progress, but we have to continue now to get to that point of what is herd immunity. And people believe that herd immunity is somewhere in that 75-80% level. And our job is to ensure that we race to get the vaccine out as the variant, before the variants would get widely spread within our state. And it's happening. And let me make one last point, Jen, which I'm really encouraged by. We recently did an assessment and we studied all of our inpatients within our hospitals who are COVID positive today. And actually, nearly, I believe it was 100% of the people who were in our hospital had not had a vaccine. So we can see within our nursing homes where we have no COVID positive patients today, in our hospitals, for those who are COVID positive, none of them were vaccinated, that the vaccine is working, it is making a difference, and we have to just continue to advocate for it.
Wow, that's a pretty incredible statistic there. All right, you're a Connecticut guy. I was reading your bio the other day. You are born and raised here in the state. You're in this huge position, where there's been a lot of weight on your shoulders trying to make these decisions. Give us a day in the life of you right now. And for the past year, I mean, it has been just incredibly difficult, I'm sure, on your end.
Jen, it's an honor of a lifetime. It's an honor of a lifetime. I love this state. This is my home state. I'm deeply committed to it. I'm raising my family here. We're a multi-generation Connecticut family. And to have the honor of serving this state in this moment, in this capacity, is something that I take very seriously, and I value the importance of it. But truthfully, I have to recognize I have 33,000 colleagues in Hartford Healthcare. The work I see them do every day is unbelievably inspiring. It's amazing. And to lead that group, to see their work is incredible. And I have great respect for everyone working in healthcare today. We've always known, under all circumstances, they're there for us when things matter most, when it's most critical. But it's probably never been more apparent in this moment. So it's a weighty responsibility, but at the same time, it's a blessing. And it's a blessing to be able to help, to figure out a way to support our state, work with our governor, do whatever's necessary to help us get to the other side. And Jen, I'm optimistic that we are turning the corner. We still have our challenges. We absolutely have to be vigilant and focused on safe distancing and mask wearing and hand hygiene in these moments, and be mindful of travel. But we are making the turn, and we will be able to see great progress as time goes forward. So, Connecticut is doing very well, and I couldn't be more proud of our state really in this moment.
I'm just curious, how many people did you have to mobilize and bring onto your staff to be able to do the testing and the vaccination efforts? I mean, were you telling people who were retired to come back? Were you getting more volunteers? I mean, how did you do it?
Jen, Connecticut is such a great place where we see the sense of community. We have 33,000 people within our organization alone, and so many people made sacrifices and were willing to be redeployed or accepted new responsibilities. But we hired a 1,000-person contingent workforce to man our testing centers, our vaccine centers, and we've enlisted volunteers. And let me just mention, Jen, one story. We had a physician last week who retired a few years back, and he wrote to us and said, with the new opening and recognizing there's going to be an increased need for vaccine, he said, how can I help? I just film on the sidelines and I want to help. So we offered him the opportunity to volunteer and work within our vaccine centers. And he sent a text yesterday to us, and he said, after 40 years of practice, and now being retired for a few years, he felt yesterday was the best and most satisfying and best experience he ever had working in medicine. So it's really incredible. I mean, it's liberating to be able to provide that vaccine, to be able to support people with testing efforts. And I just tip my hat to everybody working on the front lines.
Jeffrey Flaks, the CEO of Hartford Healthcare, as well as the president. We thank you so much for taking the time this morning, and please tell our healthcare leaders that we are very, very thankful for them.
Thank you so much, Jen. Be safe, please.
Okay, have a good one. All right, still to come.